Everybody have a good evening last night? So my name is Julie Swan, and we thank you so much for coming. I invite people to continue moving forward so that we're in an intimate, small discussion here with this room for 100 plus people. So we have a couple of things to do this morning. One of the things that I want to do is allow time for discussion with the entire group that's here, because there have been so many exciting things going on that I feel like maybe people haven't had enough chance to share in the larger group setting. So start getting your comments or questions ready for that. But I also have a couple of other things that we need to do, because this is the last time that we'll be together as an overall group. So in some sense, this is the closing of the conference. We'll be together at lunch, but we won't have microphones and fancy things. So this will also serve as the closing for the conference. So I need to do a couple of things with respect to that. I want to thank the sponsors of the conference, and you can see them listed here. I know that they've all had people here over the 3 days. And in particular this year, this is the first year that we have not been able to have a registration fee that helps us cover the cost of the conference, the cost of space and food and speaker travel and so many other things. So in particular this year, those sponsors were absolutely necessary for us to put on the conference. So I hope you'll join me in thanking the sponsors of the conference. Secondly, we've had a lot of people volunteering for the conference over the last couple of days. Some of them are from local universities. Are there any of those in the room? Raise your hand if have you volunteered with the conference. They may be working the tables still.
It's too early for students.
Oh, that's true. That's true. They have their own hours, but they have been here. And in particular, you may remember that first day when we had the industrial engineering assembly line of registration. I'm very thankful for their help. And so even if you don't see them and maybe they were just being shy, please join me in thanking the volunteers for the conference. A third group is the host of the event. So this is the first year that we've hosted with a nonprofit and non-university partner. So UNICEF was our host, and that has been an exciting thing. They've contributed so much on the content side and helped facilitate the connection here with the United Nations City. Are there some people who are affiliated with UNICEF who are in the room? Sort of raise your hand so I'll see if there are very many of you. Yes, I see several of you. And there are many more who've been here over the last 3 days. So please join me in thanking UNICEF for co-hosting the conference. And there are another couple of people, these are the last thank yous, but there are another couple of people that have been instrumental in the event, and they are doing tireless work, really, that's mostly behind the scenes. Is Katie here? Yeah, she left to go work, and to do some other things, but Katie is with UNICEF, and the other person who's been instrumental for the conference is Megan Smithgall. And Megan, raise your hand for me. I know she doesn't like
Yeah, Megan.
She's the nice one, I tell you. And we're very thankful that she's been able to help support it. Okay, any other closing things that I might have missed? Any co-chairs? Oh, thank you. Badges. These cost money. A couple people turned them in to me personally yesterday. I'll get those back in. And during the daytime, do you know if you still need these to get out of the security gate? Somebody who's local, can you tell me? Ryan, you say no. So you should be able to drop these before you walk out of security. So you can drop them on the reception table at the front. So please don't forget to do that. Right around lunchtime, we'll have a box or have an announcement, but please don't forget that. And of course, plastic badges also get recycled, so just dump the whole thing on the counter and we'll deal with that. So thank you very much for that reminder. Now we have a couple of microphones, and so I want to bring it back to a group setting. So yesterday, Jared asked you to think about a couple of things. He asked you to think about things that you had seen or heard. He also asked you to think about new conversations, new activities you've added to your to-do list. And I would add a fourth thing to that list, because this session this morning is titled about the future. And so I would ask that you think about what should be happening over the future. And by future here, I'm thinking more than next week. I'm thinking 5 years down the road. And there's a place where we would like to get, where we have last mile distribution problems addressed, we have visibility in the supply chain, we have greater effectiveness, greater efficiency, all of these kinds of things. So where is it that we want to be, and how do we get there? So I'll ask you to think about it. So yesterday you had some of that individual discussion time. But today I'll ask that we start out with discussion as a group. And if we still want to have some, we can return back to those individual and small group discussions. But we have a couple of people walking around with microphones. So I'd like to invite questions, comments, thoughts on things you've heard at the conference, questions that you have, topics of discussion. And I'll tell you, I'm a professor. I can wait until someone speaks, or I can start cold calling on people in the audience, which I prefer not to do. So make it easy by raising your hand and volunteering.
Reflections and the future. I was very happy to come. It's been a while since I've had the chance to have this kind of reflection with people that are not necessarily doing the same thing as I'm doing. And so just based on yesterday evening and actually the discussion Paolo and I had this morning coming in, looking at the future, and it also goes back a little bit to the language Chanel used in the video introduction, where I noticed some linguistic shift. And I think that has come through in many of the sessions I've attended, and that is, you know, are we moving away from supply chain to service delivery? And supply chain as a component of that. And certainly the sessions I sat in, there were issues with total cost, with the fact that it's not just about a product, but the entire range of services that may need to be provided around it, be it training, be it R&D, and then the nature of those services and the kind of agreements and contractual provisions that we need to build into that. And that came out through the panels of the last panel yesterday, where the actual owners of these problems from governments, they were alluding to the fact that they're looking differently at contracting out third-party logistics providers, that they're looking a little bit of not necessarily owning capital assets. And you look at that, and are we looking to a future where we're really going to be talking about a web of contractual relationships that are not necessarily solely product-oriented? And it's no longer just about moving a product through a system, but it's actually the nature of that system and the different entities you need to provision services around that product, from the beginning of the creation of product, the development, R&D part, the financing part, the delivery, the training, the education part. All of this is relationship web, which I think is going to be a remarkable thing to see transformation over the next couple of years.
Anyone else from this side of the room? Any reflections?
Before you get to the who else, everybody please tell us who you are. The last comment, that was Paul Molinaro from UNICEF, so thank you.
Hello, my name is Alex Mwase. I work for UNICEF in Mozambique. Regarding public health supply chain management, the way I look at it, the vision for the future, in terms of addressing the problem of visibility at the last mile. we're actually engaging in technology. And we're actually introducing all this technology using iPads and all different sorts of instruments to collect information from the last mile. But when I'm looking at the technology, on our side, I think we're looking at it as being more expensive. So I would actually request firms, that are involved in research and development on technology to actually do a lot of research and development to develop tools like, iPads that are specifically tailored for our purpose. Because when you look at the cost of buying iPads and putting in so many health facilities in the field, it is actually very expensive. I'm looking at a project in Mozambique whereby we're trying to improve the visibility by deploying a lot of these hardware, but it's very expensive. So research firms, whether MIT or Bill Gates or whatever, you should be looking at developing exact hardwares that can actually fit our solutions, cost-effective, very efficient hardware solution that we can actually deploy. But in general, I think we really need to be moving towards electronic LMIS in health facilities in the last mile. But in order to be efficient, we need to have more sustainable and cheaper technologies deployed in those facilities. Thank you.
Thank you for that comment.
Paulo Gonçalves, I'm a professor at the University of Lugano, and I also have I'm the CEO of a social enterprise on affordable prosthetic legs. So let me just talk a little bit and build upon some of the things that Paul have mentioned. What I think it's impressive in terms of, or an opportunity for the future, is the recognition and the importance of systems, broadly speaking. So I think Paul talked about this value proposition. Deborah from PAF mentioned a lot. From the point of view of my startup, when I think about the challenges in scaling, have been precisely not being able to tackle that aspect of the value proposition. When I think about the solutions that we see or the options available to humanitarian organizations, I see those as tremendous challenges, right? So the people who actually use are not those that procure or choose, and are not those that actually fund. And until you actually can get those systems together, you basically cannot influence properly the system. Now, connecting, collaborating in a way that the ecosystem thrives, that is tremendously challenging. So, I think that there is a wonderful opportunity ahead of us.
From a man who comes out of the systems dynamics group, right?
Good point.
But I think that the technology and the systems and the services that were mentioned here, they all fit together very well. I mean, we have to think about different types of business models, if you want to use that word in this environment, but that's basically what it is. And you need the technology to make the ecosystem work, right? And you're going to need different types of contracts, different types of ways of working. You're going to need interoperability, like you talked about yesterday in one of the sessions. And that's a big issue to start with. Okay, I wasn't going to ask a question. More comments? There's one there.
Yeah, raise your hand early so we can get you the microphone. Shorten that lead time.
There's a true logistician.
Thank you. I'm Tim Hutton from Wits University in South Africa. I think as we move through this process, something that I'm seeing with the advent of vans, with all the technologies, collaboration is going to be the key to it. And when you collaborate, we've had a number of efforts in Africa of collaboration that have been highly successful because everybody has a role to play. You have specialities. You can't do everything. And I think something that's come out of me is that there is more and more skill that we should be drawing on, defining whose roles are what and what we do, and through that successfully delivering our projects. We can't do it all ourselves, so we need to be looking for partners both locally and globally to ensure that everybody plays their role to the best possibility and deliver projects successfully.
Good morning. My name is Harrison. working for In Supply in Tanzania. What I think I'll be doing next week, something I learned from this conference, and something that also I learned the last week before coming to this conference. In this conference, somebody said local solutions are vital and international support needed. So I'm going to look at how I approach different things using the regional and local experience that I do have. Coming from Tanzania, I would say maybe I know the country very well, but I had a good experience last week when I tried to actually try and solve something using the way that I used to do it, and using that experience and not depending on the health facility staff who was actually working there. So I wanted to do supervision, and I planned it and said I will go and visit this person and provide on-job training, which is something that we usually do. But I never got to that facility because I did not listen to that person, because it was raining and I could not pass. I actually had to turn back. But was it possible for that person to receive that training? Yes, because there are technologies that allow that. You don't really have to be there. We have to look at different ways of providing these trainings. It was possible actually to fund those persons if you wanted, because with mobile technology that are here now, you could actually send funds. I did not need to be there. There is a video and different other ways that you could send the information to that person. So I'm going to go on and keep looking for solutions that actually are fueled by the people that are working in those environments. Thank you.
Yeah, it's not only accessibility and cost, right? I mean, if you're dealing with 5 million people that have to be trained, you won't fit them in this room, right? It's complicated. It's a big challenge.
So, a couple of things to respond to. So, if Bill Gates was in the house, he'd probably say, "Look at Apple." No. Seriously, several people have mentioned technology, but I think if you listen to the private sector, if you listen to people that are doing this, trying to solve some of the same problems in the setting. So if you go to P&G, Procter & Gamble, who have 700,000 retail outlets in Nigeria, they operate that without an electronic system. And what they do is that they define the processes, and they have the people, and of course they have the profit motive, so we understand that we don't have that in public health. But when we had a presentation in Seattle from a senior supply chain person from Starbucks, he said, "Make it great, then you automate. Don't lead with the technology. Make sure you have the people and processes and the supervision systems and the feedback loops to make sure that whether it's the health workers or the supervisors that are collecting the data, that there's some meaning to that data." And I think if you try and build an electronic system without having that bedrock, you're going to have a problem. So that was just a comment. And then looking forward, one thing which I think came up in a number of the presentations, and I think, largely with people in the room, I think we have technical solutions to move the product, transport solutions to move the product. We have information solutions to collect the information. The one thing that's missing is the financial solutions. And I'm not talking, and again, we use the term, business model, not because we're trying to make a business of it, but how does that money flow? And when you have a decentralized government apparatus like the counties in Kenya or the local government areas in Nigeria, it's really hard for that money to flow down to the workers so that she has the money to go and collect the her vaccines, or she has the money to pay a transport provider to come and provide her with the family planning products. And so I think that's the thing moving forward, the financial doing what is necessary to understand what are the financial models, what are the ways of ensuring that the finances are flowing, because I think we have already, and we've had some great presentations this last few days, we have some technical solutions, we have some great technology solutions, but it's the financial solutions are the struggle. Thanks.
Good morning, everyone. My name is Estelle Visionary. I'm with Crown Agents. It was fascinating yesterday during the session that we had late afternoon yesterday, particularly the point when David raised the issue of gender in health supply chain. I think it just got me thinking, what are we doing in our projects, particularly as Crown Agents? How have we been factoring in issues on gender? And I could not really come up with an answer and say, we are not doing much in that area. So it just got me thinking, and I think it's one of my takeaway issues from this conference, to see how can we put in gender issues in the projects that we're working. But I'd like to also pose a challenge to the academics who are here, who do research and academic papers on issues in supply chain, I think to also do much more in trying to find out what are the issues on gender in your supply chain. And I'm hoping that when we have the same conference next year, I think it will be an issue that will be brought out as a major focus, either through a plenary session and people working in the area for the next year to come up with issues that they found out on gender issues in your supply chain, and then we can have a better understanding and incorporating those issues as we go forward in building capacity in your supply chain. Thank you.
Thank you for those comments. So I thank all my brothers this morning for sharing their insights and learnings. I want to hear from my sisters now. Any of you would like to share some thoughts and reflections?
Hello, my name is Hannah London. I'm from Uppsala University and I'm a master's student in Humanitarian Action. I must say thank you so much for these last few days and all these wonderful insights. I've truly learned a lot during these days. And I must agree with the reflections on gender last night. The things that really came home with me was the humanitarian logistics and health and gender. And I'm really looking forward to see what discussions this will bring forth. And it was very enriching. Thank you.
Any other sisters?
Thank you. Good morning. My name is Diana Shakur. I work with UNICEF in South Sudan. My takeaway points from the discussions that we had and the training is related to the session that one of the gentlemen from JSI actually spoke on, that's in relation to the 10 counties. And what he was looking at there is the issue of capacity building in the 10 counties in Kenya. And what really resonated with me was the simplicity with what some of the activities that they're actually doing was. Because I think a lot of times when people are trying to build capacity, when people are trying to bring up maybe some of these health facilities up to speed, we try and come up with all the sophisticated technology, and we're trying to come up with all these systems that are way, way over what maybe the health facilities will be looking at. But just the simplicity with which the 10 counties were actually being supported, and then seeing the results in terms of reporting, in terms of reduction in the stockouts, it really got me thinking that at times maybe what we need is just simple, basic solution, that after which these health facilities are able to come up to a certain level, then you can graduate them to something more sophisticated. But simplicity is actually the bedrock of ensuring that some of these issues are actually improved and some of the solutions that we're looking for are actually implemented. Thank you.
Any more comments from anyone?
So let me say two things which I forgot to say at the beginning. Speaking of capacity building, do we have someone in the room, raise your hand, who wanted to comment about some activities that could go on after the conference? Walter, where are you? There you go. Can someone get him a microphone, please? He asked to say something about one thing that, that people could do afterwards.
It wasn't stop drinking. So I wanted to talk about IAPHL, which is the International Association of Public Health Logisticians. Many of you are already members, but it is a global south-to-south, expert to newcomer to students, conversations that go on through our listserv. It is a free association at this time, and so we have members from all over the world. If you're going to get in this field, I know students have used it to say, I'm looking at this, and they get a lot of help from people from all over the world. Experts will join in, but you also get the person who's the district pharmacist in someplace in Indonesia talking to the district pharmacist in Nigeria about how they see the view, they see what's coming on. So you can join for free. It's iaphl.org. You can just Google IAPHL and you can join, and the membership is growing. And we are further advancing it as we go, and the website's being further advanced. It also now has instant translation in French or Spanish, so once you set your language, as things come in the listserv, it will translate it if you're Francophone, it'll translate into French, or to Spanish, or in English. And even if you're like me, you want to still read the French because you're not sure of the translation, it will still let you do that as well. So again, I would encourage you all to join. The humanitarian group has been a smaller group, but it's growing now in IPHL. So it's coming on, and of course we're often looking for people to be moderators. There's like maybe 4 or 5 people who join to keep the conversation going. It might go for 6 weeks. And so we certainly could get a humanitarian issue. We've had all kinds of issues, and people have looked at all kinds from quantification to the HR issue and I haven't seen one in humanitarian specific logistics, but it could very well be someone in this group that chairs it and gets it going. So thank you.
Thank you for that. We have...
Yes, my name is Thomas Fernandez from the Humanitarian Logistics Association, and I see a synergy here.
and yes, HLA, I've now added it to the slides there. I'm glad that you're here from that group. Thank you.
Yes, thank you. So we are a group of humanitarian logisticians, practitioners, and also academics, and we are going to open also for corporate membership soon. And the purpose is also that sometimes you're in the field, you face problems. There's a lot of knowledge in the world. There's a lot of knowledge in this room. And we need to share this in order to have more efficient and effective solutions for the beneficiaries. Yeah. There's a flyer outside also.
Great. Yeah, you said you had about 2,000 members, right? So it's substantial.
About, yeah, between 2,000 and 3,000. I don't know the actual figure at the moment. Yeah.
Great, thank you. And there will be also some other ways to engage with others. There are LinkedIn groups, there are Facebook groups, there's Twitter for those of you who are media savvy, whoever you are. Now, there's someone, microphone here, please.
Thanks. My name is Andrea Papin. So there's 2 things. One, I am a gender advisor, and I wanted to let you know that I found this meeting really fantastic and very, very interesting. I also wanted to let you know that this isn't my area of expertise. I work on, I keep saying I work on persistent and structural gender inequalities, so that I get to come here and talk about really practical ways to change gender equalities has been fantastic. I've gone to meetings where I've been able to talk to people and say, hey, can you do this? And they say yes, and it's amazing. So please talk about gender next year, because the entry points that you have to impact and affect, well, women's lives, but also men and women's lives and girls and boys' lives is really quite extraordinary, so please do that. But the other thing I wanted to mention, because I'm here in part because I'm representing the chairperson of the board of directors of an organization called Report the Abuse. And Richard Brennan at the very first talked about operational support. Report the Abuse focuses on ending sexual violence against humanitarian workers. And if you're not familiar with that, humanitarian workers, there's a significant amount of violence that occurs for people who work for your organizations. And if you aren't familiar, please go to our website, which is www.reporttheabuse.org, and you can look at strategies to ensure that your staff are protected and to make sure you're compliant and have tools and mechanisms to protect your staff. And if your staff need to report that they've been sexually assaulted or violated or harassed, that you're responding to that. So, and that's something you can do right away. So,
Thank you for that. Any final comment before we move on to workshops and presentations? Okay, so two other small announcements. There are evaluation forms. You may have gotten one yesterday. You may have seen one today. I encourage you to fill these out, leave them on some table that looks appropriate, or the 2 boxes that say, please leave them there. That would be great, yeah. But every once in a while we find one floating, and we'll collect that as well. And then there's a location change. I've just written it up there. So for the workshops or presentations that are listed as being in Auditorium 1, they are not. They are going to be upstairs in the VIP room. We'll have somebody show you where that is, but go upstairs for those that are in Auditorium 1.
Yeah, if you'll meet at the end of the hall next to the press room, and that circular area, we'll all go up together to the VIP room.
Great. And we'll see everyone in the coffee break upstairs between sessions, and then in the lunch in that space as well. So thank you very much for coming, and we'll see you the rest of the morning.
Thank you.